I'm Dr. Leslie Kernison. I'm a board-certified geriatrician and internist, and I practice primary care 4 days a week at the Over 60 Health Center, which is a community clinic in Berkeley. I have found that caregivers are actually really often involved in my day-to-day doctoring work. To begin with, many patients come to the visit with a caregiver, and often that person is really involved in the visit and asks a lot of questions, or might be reminding the patient to tell me something, or is taking notes. In fact, I've found that often the caregiver seems more concerned about the health problems than the patient is. I think a lot of people are a bit ambivalent and conflicted about coming to the doctor because they don't like to feel old or sick. Often they've only come because a concerned spouse or other family member has insisted that they come in. And then they come, but they don't want to complain, or they might worry that by telling me about something, it'll turn into a real health problem. So often I find that the caregiver is actually prodding the patient to tell me something and to get a problem addressed. And then the patient might want to just postpone doing anything about it, whereas the caregiver is often really concerned and wants the best care possible as soon as possible. Patients seem to often procrastinate about getting to the pharmacy or getting the refills, and so the support and encouragement of a caregiver can often make a really big difference in that step getting taken, especially if the person is older or sicker. That's actually one of the reasons that I really like having caregivers coming to all these visits or calling me about their loved ones, because I found that often older patients can't, or sometimes won't, follow through on medical recommendations unless somebody is helping them do so. Nowadays in medicine, I find we really expect patients to do quite a lot for themselves when it comes to chronic care, but that can be really hard when people get older and sicker unless they have a caregiver involved. So as the population is aging, I think more and more we're going to be depending on caregivers to help us provide the care we want.